Diabetic retinopathy is a condition that affects the small blood vessels at the back of the eye, and indeed it's one of the top 5 causes of visual loss in the world, and indeed the only cause which has increased over the last 30 years. In the LENS trial, we sought to investigate whether a drug called fenofibrate might reduce the risk of developing worsening eye disease from diabetes. Now, fenofibrate is often thought of as a drug which lowers cholesterol and blood fat, and indeed for the last 20 years it's mainly been used for that purpose, but there was some promising data that it might be protective of the eye. And LENS is the first large trial to really investigate this in more detail. So the trial was heavily embedded in NHS in Scotland, in particular in the diabetic eye screening program, and we were able to recruit patients who attend retinal screening every 6 to 24 months. And really it's this partnership with the NHS that I think made the trial able to be so effective. So over the course of about 2 years, we recruited 1,151 participants across the whole of mainland Scotland who had early to moderate diabetic eye disease. And over about 4 years, we found that fenofibrate was indeed protective of the eye. About 29% of patients receiving placebo developed worsening eye disease, and 23% receiving fenofibrate. So that means that fenofibrate reduced this risk by over a quarter. We also found that macular edema, which is swelling at the back of the eye, was reduced by a similar amount, and also that fewer treatments were required for retinopathy in people receiving fenofibrate. The trial included about 75% of patients with type 2 diabetes and about 25% with type 1 diabetes, over 300 participants with type 1 diabetes. And we found that both those with type 1 and type 2 diabetes seemed to obtain similar benefit from the treatment. We also saw that patients with mildly impaired kidney function had similar benefit to those with normal kidney function. And there were other groups we looked at as well, and all appeared to have consistent benefit from the treatment. It remains unclear exactly how fenofibrate is giving benefit to the eye. It looks far more likely at the moment that the benefit is given by the drug actually acting within the eye itself and not to do with any effect on circulating cholesterol or blood fat. Going to the future, we will continue to track the participants in the LENS trial for up to the next 10 years by linkage to the NHS Scotland records. And we also have a valuable biobank of about 9,000 retinal images, which we'll be analysing in far more detail to better understand the effect of fenofibrate in the eye.